Hey everybody, I'm so excited. I have a special guest today from Uva Life, and her name is Amy Divaraniya, and she's the founder. Like me, she has a very personal story to share. And that's kind of what landed her in the fertility space. But today's topic really is, how do you know if you have actually ovulated? So most ovulation kits on the market are all about what is your fertile window. And this particular kit that she's developed through Mount Sinai, she's going to come on and join us and talk to us all about the science behind it, the technology behind it. She's going to show the product. It's a beautifully designed, something that looks really nice sitting on your bathroom vanity. Here she comes. And I think that everything that we do is always based on education and inspiration. So I want to start with, there she is. Hi, Amy.
Hi.
Oh, I'm so happy for you to join us today. It's so nice to see you too. So I think what we want to start with is, your own personal story. So why don't we start there? Because you're still kind of a relatively new mom. My guy is so old compared to yours, and he's only 2. So what led to you even being, interested about this? What was your kind of path?
Sure. I think a good way to start is to give a little bit of background on myself so you kind of know where I'm coming from. So I have a PhD in biomedical sciences from Mount Sinai Hospital. But before that, I actually come from industry. So I was a data scientist at Roche for about 5 years, and then a researcher at Bristol Myers Squibb prior to that. So the reason we started this company was because I had a very difficult time conceiving my son. We expected it to be difficult because I've had irregular cycles my whole life.
Wow.
My husband and I were both in our 30s, and I have this additional issue where I've been diagnosed with celiac disease. So,
got it.
Yeah. So we decided early on that we actually didn't want to go the invasive route. I didn't think I could deal with the loss of a potentially failed cycle or a miscarriage. So we were like, if we don't conceive naturally, then being a parent just isn't in our cards. And we were both okay with that. So I started doing everything right. To be honest, I was in the best health and shape of my life during that time. Luckily, after 18 months, I conceived my son. But those 18 months were the most devastating of my life. And I did everything right. Like, I did everything to the book, right? I peed on every stick I could get my hands on. I used every fertility tracking app. I took my BBT at 4:30 a.m. every day. And that wasn't me being crazy. I actually woke up at 4:30. So it wasn't me just being insane. But I did wake up.
You were in newborn training at that point.
I was at the tail end of my PhD. That's what that was. It was like self-inflicted torture.
Oh boy.
But the worst, like I said, I conceived my son after 18 months, but I don't really give credit to the fact of all that data I collected, because really all I learned was that I had irregular cycles, and I knew that going in. So I tried to hack those tools to work for me, and I found that they were hardwired for women who had that perfect 28-day cycle, and that just wasn't me. So as I started thinking about like what I could do, I was like, if I knew what my hormones were doing, I would know exactly what to do and when to do it. And that's really where the idea for UVA came about.
That's incredible. And so then you kind of shifted your whole life's focus.
Yeah,
right?
I never thought I'd be doing a company. I thought I was headed to pharma again, which is where I started. And here we are 3 years later.
So let's dive into that a little bit. I think that there's a number of things that our audience that has logged on can relate to. One is the feeling that you're doing everything right, that you're peeing on every stick, that you're eating all the right things, you're in the perfect shape, you're perfect this, the timing's perfect, you do everything the way that they say to do it, and then you still have it month after month after month. I think people really relate to that. What is so special about what you've invented?
So I think like everyone's doing things by the book, right? And who defined what that book is? There are like studies that have been done years ago with women who, if you look at the criteria for the studies, these are women who have the perfect cycles, they're in the perfect fertile age, and typically they're Caucasian women. Well, that's not me at all. So what that textbook is designed for is not designed for somebody like me. So the beauty of UVA is that we've completely personalized the experience for every woman. We're not comparing her data to some standard threshold. We're not comparing her to some mold that we're all supposed to apparently fit. we determine what your mold is by your data and then detect fluctuations in your hormones by comparing to that. So what we actually do is quantitatively measure 2 key fertility hormones, luteinizing hormone and progesterone. So we're able to, one, tell you when your most fertile days are, and then second, we're able to confirm that ovulation actually occurred.
That's amazing, because that's what we can't do today. Today, the over-the-counter ovulation kits can't confirm whether or not ovulation actually occurred. And that's the $1,000,000 question, right?
Exactly. Yeah. I mean, we're all having kids later in life. And unfortunately,
not on purpose.
Not on purpose. No, we're all busy, right?
Yeah.
And
right.
I mean, go us for wanting to achieve some goals, right? Shouldn't be punished for that. And I think that a lot of the difficulty that women are facing is they may not conceive every month, but is it because I missed my surge, or is it because I didn't release an egg this cycle? Right. And UVA really starts getting to the root of those problems.
That's incredible. So I think that that's kind of, a big area of education that we should just go ahead and dive into, actually, because the fact that you've added progesterone is the missing link to knowing whether or not you've ovulated. Right. So can you kind of walk us through the background of that, of what happens in the body biologically when we do release an egg?
Sure. Yeah. It's kind of nice because as much as like we have irregular cycles, our hormones do work in synergy and they all have a function in our reproductive cycle. So like, let's talk about all these hormones, right? So first you're going to have your period, and that means that all your hormones are at their lowest point because you're shedding everything that's inside. You're basically gearing yourself up for the next chance to try to conceive. Once your period's over, your estrogen is going to start to go up. That's going to signal to your brain to start releasing LH, because now what LH is going to do is actually release the egg from the ovary. And you want the egg to be available for the sperm to be able to fertilize it, right? So the idea here is that when your estrogen surge starts to happen and the LH surge starts to happen, you want to start having intercourse every other day to ensure that the sperm is present when the egg is released. Sperm can live inside of a woman.
Amy. That's a lot of sex.
But you should do it every day, right? It should be every other day.
Every other day, exactly. You got to give the men a little time of build up in between so that you get some fresh sperm too. It's not just all about the egg. Yeah.
It's not really a lot if you think about it, because you're talking about 5 days.
Right.
So you're probably having intercourse maybe 2 to 3 days in the cycle to optimize your chances of conceiving.
Sure.
But the thing about LH is it's a pulsatile hormone. It's not consistently being released, right? It comes out in spurts. So what your body is waiting for is for the LH to hit some like pivotal threshold that will push the egg out of the ovary. And once the egg is out and in the uterus, it will form a corpus luteum, and that starts to release progesterone. So the beauty of progesterone is that it's really not present in your system until the egg is released. Now, with our data, we're actually seeing some really cool behavior of progesterone, but we can talk about that later.
Interesting.
Yeah. So basically, your menstrual cycle is broken up into 2 phases, right? The first is the follicular phase, which is everything up until the egg is actually released or ovulation occurs. The luteal phase is everything after the egg is released. So progesterone is supposed to have the biggest role in the second half, and you're only going to see that rise in progesterone happen if you release an egg. If you don't release it, the progesterone will remain low. So
that's so fantastic. I mean, just 2 days ago, we were talking to Dr. Serena Chen on this show about women with PCOS whose LH is all over the place all month.
Yeah.
So if women who have PCOS are only tracking LH, they think that they're ovulating, but without this progesterone, they won't know if they actually did.
Right. And that's a really critical piece. And now for women with PCOS, a common symptom is that their LH is consistently elevated. And so the OPKs that are available on the market are just not going to work for them.
So you literally might get that smiley face every single day for a whole month. And it's like, what does this even tell me? Okay, well, that has to be confusing.
Right. Or you could be on the other end of the spectrum like me, where your LH is just super low and you just never get that positive. I found out with UVA that my surge is significantly low, but I still ovulate because I get that progesterone rise.
So isn't that interesting?
On both ends of the spectrum. Yeah.
Why does that?
I never got that positive.
Why is that?
It's just your hormones. Like whatever's normal for you. That's the thing. Like that's not
what's so personalized about UVA is that you just learned what your normal is rather than your normal compared to my normal.
Exactly. Why is
if only we could do that in genetics.
I know. They're getting there. There.
Okay, well, let's talk about kind of the mechanics of it. Do you have your kit right there? You can hold it up. I mean, I think this is so great to take a look at it. You designed a really beautiful product.
So it's all white, I know you said it's a beautiful product. It's all white, but it totally functions. We did this early release because of COVID, but it's helping a lot of women. So we're happy to do this. So the kit comes with a holder. This is actually getting redesigned to something significantly smaller, a handle, and then a month's supply of disposable cartridges in a box like this.
Great.
Each cartridge is individually sealed. So it's in a packet like this, and this is what it looks like. Right.
Okay,
so
awesome.
You get a sample pad, a QR code, and then a window that shows you 1, 2, or 3 lines, depending on your hormone concentration. So one big thing is that we're measuring LH and progesterone every time you use an UVA strip. We're not telling you use your LH strips first half and the progesterone strips second half. It's all in one.
Got it.
So we're getting both hormones every single day that you use an UVA strip. We work alongside an app, a smartphone app. So what we do is when you register in the app, we collect a ton of information from you. And we feed all of that into our machine learning algorithm. And then we determine what days you have to use an UVA strip. So one of my big pain points when I was trying to conceive was because I have irregular cycles, I never knew when to test, right?
So you don't have to use an UVA test strip every single day?
No, you don't.
Ah, cool.
What we do ask, though, is once your scanning window opens up, you use it for 15 consecutive days in your cycle, right? But that window shifts according to your cycle and your personal window.
Got it.
On a scan day, you hit start in the app. It instructs you to provide a sample. We work midstream or as a dip test, whatever is comfortable for you. Okay. You then wait 10 minutes. There's a timer in the app. And you scan this. It's similar to doing a mobile deposit.
Like a QR code. Like a little, like a mobile
exactly
deposit. That's great. Okay, I like that. All right,
just deposit.
Okay. Excellent.
So you're not taking a picture. You're not storing a picture in your photo gallery or anything like that. You're literally scanning this, and then we interpret the results for you. So like with the LH strips, right? A lot of women take pictures of it, timestamp it, and are like, is it lighter or darker than yesterday?
Right.
They're not designed to work that way. Yeah. But UVA is. And we don't expect you to interpret it yourself. We do all of it for you. So our app actually has all of our computer vision algorithms embedded in it, and we do all the analysis directly for you, telling you exactly where you are in your cycle.
Super smart.
Yeah. Is it low, high, peak ovulation? Did you release an egg? How many days post-ovulation? And gives you your hormone concentrations.
Adrienne, Abor1, thanks for joining us. She wants to know if the product's available in the USA, and it most certainly is. Yeah. So Amy is in New York City. That's where she quarantined. That's where she founded the company, right? So if everybody goes to uva.life, then they'll be able to purchase the product there. One of the things, I'm older. I'm getting ready, to do an embryo transfer, my second one this fall, and I already have embryos made. However, I am 44. So I've often been curious, and I feel like I know my own body well enough to know that I am still ovulating, but it does feel like it's a very useful piece of data, even for those of us that are maybe that perimenopausal, entering into menopause stage, where we can sort of figure out, I hear your little one. Hi, buddy.
I know.
Where we can find out if we are even releasing eggs, right? Because the definition of menopause is when you stop ovulating, right?
Exactly. So the progesterone is really useful. Now, I will say, like, for a menopause product, it'd be great to have estrogen in there as well. So, but if you have that specific question, am I ovulating? Yeah, UVA can 100% help you with that.
Yeah, so I'm definitely going to get it, and I'll hop on and kind of share with everybody what my first month of results are. I think it's just a curious, it's good to know.
Yeah.
What questions does our audience have? I'm going to keep asking Amy questions, but please keep asking questions. What you want to know about ovulation, what you want to know about whether or not you're ovulating, if you're concerned about not ovulating. We have a PhD scientist right here with us who is a startup CEO, who is a mom, who founded her own company, invented a product that she needed to use, invented it for women like us. So certainly ask away. Now, Amy, it's available with an iOS app today, correct?
Correct. Yes. We will have Android available very soon. We're working hard on that.
Okay, great. Is there somewhere on their website that they could sign up maybe to find out when it's going to be available? Is there like a contact list or something that?
We're going to be rolling that out on Tuesday, actually. So they can sign up for the wait list on Tuesday. Yeah. Or if they're very eager, they can send me an email at amy@uva.life, and I'll add them to the list.
Okay, got it. All right, perfect. And you can also direct message, of course, Uva, right from their Instagram account as well. I think that, what we've seen in doing some of these episodes with some of our other key opinion leaders who are REIs and OBGYNs, or even our naturopathic specialist, Dr. Raquel, is that $1 million question is how do I know if I'm ovulating? When should I have sex? So if I go into the app and I look at my report over the course of a month, what does it look like? Is it a big chart? Are you going to tell me then the next month, what to expect, or do you need a couple of months of data?
All right. So there's a few questions in there. Let me try to address it in order. So what do you see? On a daily basis, we provide you with a contextualized result. Are you in low, high, peak ovulation? Did you release an egg? So it's contextualized, right? And we determine that by looking at your hormone levels and comparing it to your own baseline levels. We also provide you with a normalized hormone concentration for both LH and progesterone every day. In addition, you get a daily action plan. So that's something in nutritional health, physical health, and emotional wellness to really take control of your fertility journey again. This is really built for somebody like me who is super type A. And when they could not conceive, they were completely
you wanted to get an A on your trying to conceive test, right?
Yeah, I failed. Let's just be honest. I failed.
It took you 18 months to get that A, but you kept working at it as hard as you work at everything.
God. It's like, honestly, it was like studying for your MCAT 18 times. That's what it felt like.
Yeah, I bet. No, of course. Yeah.
But it was horrible. But the worst thing is that you don't really know what's going on. So we wanted to try to guide you and what to do every single day so you can take control of your journey again.
Right.
But then after you scan for 15 days, you're provided with a report that shows you what your actual hormone trends were. And then we also give you a table that shows you what your values were each of your cycle days that you measured. So you have this I
love that because it's just like I was going into the lab every single day, which I'm not going to do. And the fact that you can do that from home right now, given, quarantine and everything, is just fantastic. Honeybees Jewelry has some great questions. I think we're going to go for about 10 more minutes, buddy. That's my Dante. We're going to go for 10 more minutes. You can come say hi to everybody if you want to. Yes, yeah. Hashtag Startup Mom Life. How do you know if you ovulate? So some people are just hopping on now, and that's perfect. We're going to answer this question too. She mentioned that once her MC was clear and egg white. So I think that the benefit, right, of UVA is that honeybees, especially because I saw a little bit further below, you mentioned that you have PCOS. And the key that Amy is describing is that you need that progesterone measurement to know if you actually ovulated, because the progesterone is released from the egg itself, from the outside of the egg, called the corpus luteum, correct?
Yes.
All right, I'm ready to take I'm ready to defend my PhD, Amy.
There you go.
I got that right. So honeybees, that is the key, is that their test looks at LH, which with PCOS can be all over the place. And also can be elevated all month. So you could think that literally you're ovulating every day, but you don't know that you are until you release that egg and the progesterone shows up. There is no progesterone in your cycle until then. And what else could also be, kind of interesting, Amy, is I'm wondering for those low producers of progesterone, even if they do ovulate, are you seeing trends in the data like that too, where you can kind of tell that there's a cohort of low progesterone producers?
Yeah, it's really interesting. We're getting such cool data. And the really awesome part is that this kind of data doesn't exist, right? Like the only time series hormone data that actually is available are women who have gone through IVF or IUIs and are heavily medicated. So it's drastically influencing their results. UVA is really the first one to come up with non-influenced hormone data. And it's very interesting to see. So because it's a personalized approach where we're getting what your baseline levels are, we're able to detect those surges regardless of how small or big those surges are, right? So if you have latent progesterone and you just have very low levels, typically we'll learn that. So I think one of your earlier questions was do you get smarter over time? How accurate are you from cycle 1? We are pretty accurate from cycle 1 because we are getting the personal hormone baseline levels, but there's a whole machine learning algorithm on the back end that just gets smarter with every use. So we do learn every subsequent cycle.
I love it. I can't wait to get it. I should have got it before this. It's just so great. What other questions does everybody have? This is fantastic. I want more data. I love that. I mean, I think we're in such a data-driven, personalized healthcare environment. And, given the bizarre nature of this world, with COVID and with quarantine, anything that we can do at home that can empower our decision-making, it seems to be a good idea, right?
Yeah.
So
that feeling is not like, you're not thinking that in isolation. I think clinicians are much more open to it as well. So actually our platform has been adopted by many clinicians, enabling women to do remote hormone monitoring, and your doctor will actually get the real-time hormone measurements on their dashboard. So we've created a platform for doctors to be able to view your hormone data, and you don't have to go in for those regular blood tests. You can just do everything from home, and they'll call you in when something needs to happen or a procedure needs to be done.
Such a great point. We have a virtual care clinic that has partnered with Uva Life. Dr. Gary through Fertility Cloud will do remote cycle monitoring, and he will cycle people on Clomid or metformin or letrozole, whatever he thinks is the ovulation induction strategy that makes the most sense, all from your home. And you don't have to go in. You have to qualify for the program. But that's how clinically accurate your product is that you have IVF clinics and ARIA doctors and all kinds of other healthcare professionals who have joined you so that me as a patient, I can voluntarily share my data directly with my provider. And it's easy, it's seamless. I don't have to do anything extra. Yeah, exactly. Which is just incredible.
Yeah, that's the benefit of technology today, right?
It is, exactly. Okay, honeybees, you're asking such awesome questions. Thank you so much. Do you have to do this at the same time every day, or is it just once a day? Does that matter, Amy? That's a great question.
Yeah, so what we ask, are we back? Sorry.
Oh, that's okay. So, yep, that's okay.
Yes, that's a great question. What we do ask is that you use it around the same time every day. So like, for example, I did mention earlier that LH is a pulsatile hormone. So it's being released in spurts throughout the day, right? So if you're going to use UVA after you're in your first morning urine, for that cycle, we ask that you use first morning urine for all those measurements.
Got it. So just be consistent no matter when you're doing it.
Exactly.
Okay. Right. Yeah. Okay. Don't do it all over the map just so you get the cleanest data that you can.
Exactly.
That makes sense.
We just want to eliminate as many variables as possible.
Right. So honeybees also asked, do you think it's good for IUI? So this is a complicated question because not every state allows for at-home IUI. Yeah. So there are some state law considerations with that. And if you want it to be a physician monitored at-home IUI in your state that allows for home delivery or pickup of anonymous sperm donation, or if you have gone through all the channels for a known sperm donor to do IUI and you have all the legal documents in place and so forth, we still advocate and recommend that you still have physician oversight for that. So some of these partnered programs and doctors, that Amy already has on board or that Fertility Answers has on board could help kind of guide your decision-making on that, honeybees. We're not opposed to at home. We know that everyone deserves to make this assisted reproductive journey people hate that word. I've got to stop saying the word journey. Make the assisted reproductive experience as romantic as humanly possible. I mean, my son was conceived in a lab. He was transferred in a, clinician's office. I have never had the benefit of like having any romance associated, with baby making at all. But I completely understand that at-home IUI has its place and it can make the experience feel, like the whole couple is involved and that it's so much less clinical. But we just really recommend physician oversight so you kind of know exactly what you're doing and when. And so, yes, the timing is really important. And yes, UVA can help with that. That is, absolutely one of the ways that they can help. I'm just advocating for have a doctor involved.
Absolutely. And I think like if your doctor is not already an UVA provider, they can very easily become one. They just need to reach out to us and they can do it on our website. They can view your data at home. So like if they're open to that, then UVA can definitely be helpful. We've had UVA be adopted by many natural cycles. It's been utilized in IUIs, and I think it's been really informative.
Yeah, that's great. And now, perfect. Thanks, honeybees. You're awesome. And thanks for asking so many questions. It's great. And then we have one about the price. That's a pretty important question too. What's the price?
Sure. So the starter kit, which comes with the handle holder and a month's supply of the disposable cartridges, is 15 in a box, is $199.99. And then the refill kits are $169.99. We will be rolling out a subscription plan on Tuesday, actually, which will have additional discounts.
Lots happening on Tuesday. Okay.
A lot is happening on
discounts
Tuesday.
are coming on Tuesday. Okay, good.
Yes.
All right. That's
We're
perfect.
excited.
Yeah, exactly. All right, great. Let's see. Has there been any success stories yet? So Lauren asked, has there been success stories?
Yeah, we've been so excited about this. So there's a few that I'd love to share. We've had a lot because I think just the fact of being able to time out when to have intercourse based off of your own data has just been so empowering to women, and we've been really accurate at this. So it's great on that front, but I'll share like a couple of stories. One, we had a woman who conceived naturally with UVA when she has never been pregnant naturally, and she was about to begin her IVF cycle the following week.
Wow.
We were looking at her data, and I was like, oh my God, her progesterone and her LH are really high. How do I tell her to go get a pregnancy test? Because I don't want to get her hopes up. She's never naturally been pregnant.
Oh my gosh.
And we reached out, and I was like, I think you should go and get the pregnancy test done, but please just don't get your hopes up. I just want to know if our test is really messing up.
Right.
It was
cautiously
positive.
Optimistic. That's amazing. How exciting.
That was a really great story. And then the second one I'd love to share is we actually had a woman get pregnant who had just recently delivered her baby and hadn't had her cycle return yet. So when she registered in our app, she actually entered her period as over a year ago. And we were like, oh my God, was this a typo or is this real? So I reached out and confirmed that. She's like, no, I got pregnant. I delivered. My period hasn't returned. I'm still breastfeeding. So we were like, all right, first cycle, we might be a little off, but we'll figure out what's going on. So we monitored her. And first cycle, yes, we actually were able to capture her surge. She was still cycling, even though she wasn't having the period. And second cycle, we got her pregnant.
Oh, she was still breastfeeding?
While she was still breastfeeding. I don't know how she's doing it, but she's doing it.
Oh my goodness. Well, more power to her if that's what she wanted. That's incredible. Yeah. And also just sounds overwhelming, but that's amazing though, that it was that accurate. And I think what you guys have said is that it's kind of like bringing the lab into somebody's home because of that accuracy. So I suspect over the next year, we're going to be hearing a lot more success stories as you guys kind of embark on this.
It's a really rewarding effort to be a part of, to be honest. Right. Like, I just know how, like, the emotions that, like, I was going through, and I can only imagine how hard it is for a woman that is even considering going through an invasive procedure. Like, if we can help even a little bit to ease some of that stress, to me, that's a success.
Yeah. Akhtiar asked a great question. It's not probably one for Amy and I to answer, but we can answer a portion of it. And then I'm going to have you DM us that question so I can get one of our medical doctors to answer the question. She's 20 years old, suffering from PCO, and wants to know what the success rate of IUI will be in her case. So I think the first thing to address is that you can successfully measure whether or not she's ovulating consistently month over month with PCO, and that this, again, is a perfect case for someone in her situation, because if she has a healthy sperm source, she can conceive without medical assistance, without needing an IUI, unless she is using a donor. And if that is the case, the first thing to do that even her doctor would be doing is looking to see if she has ovulated. And that's the magic of the UVA product, is that it will tell you whether or not you ovulated, and you have to have the progesterone measured to know whether or not you actually released an egg. So Akhtiar, I will say, with IUI success rates, they can be very successful if you are ovulating. The concern with PCO, don't worry, everybody, that's her gorgeous little adorable son, that the concern with PCO is that you aren't ovulating. And so if you're not ovulating, then medications like Clomid, metformin, those types of things are sometimes warranted. Clomid in particular is because it helps induce ovulation. So there are, working in tandem with Amy's product, UVA, and then with our virtual care partner, Fertility Cloud through Dr. Gary, both of these areas or these opportunities and these strategic partners can help you be very successful. I think we need some diagnostic data first, though, to confirm whether or not you have a PCO case that is preventing you from ovulating or not. So the first step would be with UVA's product, to see if progesterone rises during your cycle, so you know whether or not you've released an egg. And I think it's important too, Amy, for us to kind of address that we need 2 months of this to know, because somebody might not be ovulating from one ovary versus the other.
Exactly. And I think this is just getting that information as to whether you're ovulating or not is so critical. And it'll be interesting to see how her trends actually play out.
Exactly. Right. Yeah, perfect. And we have, let's see, so we have Bianca. I love that name, Bianca. She had her saline test done and everything was fine, except they saw some uterine polyps. How long after the procedure to remove the polyps can I try to get pregnant? That's going to be another great question for your doctor, but you can hop on the Fertility Answers app and ask that question because our medical doctors can answer that for you. But feel free, Bianca, to DM it to us and then I'll make sure to route it to Dr. Chen. We have on the Fertility Answers app, it's available on iOS and Android. We have over 370 medical providers and board certified professionals. We also have reproductive attorneys. So if you have any question at all related to this path to parenthood, you can ask it on the Fertility Answers app. Everybody is a volunteer answerer, so everyone is board certified and a professional in the space, but they are volunteers. So if it's a really urgent question, we have a tiny rush fee that we've enabled because it routes very quickly and kind of in a different way. So if it is an urgent question, just let us know and we'll get it answered for you the same day, often within just an hour. Now, Lauren has unexplained infertility, never been pregnant naturally, and got pregnant with her first IVF. Unfortunately, miscarried. I'm so sorry. Our chances conceiving naturally higher. So unrelated to that, those are some diagnostic questions that we wouldn't be able to answer. I will say, though, that I think, Lauren, this particular type of product would be very empowering because if they stimulated ovulation for you through IVF, successfully retrieved eggs, then that gives me hope that, she could learn a lot from what's going on with her cycle through you. Exactly. But she was able to have a successful egg retrieval and make embryos with your sperm source. So I would certainly encourage you, Lauren, to just empower yourself with the kind of data that you can get from UVA to kind of know yourself what's going on a little bit more. And you can share that same data with your IVF specialist. Unexplained infertility is so incredibly frustrating because it feels like a non-diagnosis diagnosis.
It feels like a catch-all. Like, I don't know what's going on.
Kind of like how IBS.
So here we go.
That was like how IBS got invented. The name IBS came from I'm a GI specialist and I don't know what's going on with you. So we're going to call it irritable bowel syndrome, right? That's how it started. Yeah. And I feel like the same thing with unexplained infertility. However, Lauren, people with unexplained infertility, they do conceive all the time. They conceive unassistedly, without medical intervention, and they succeed successfully with medical intervention. Unfortunately, the data does show and does confirm repeat IVF cycles, if you keep doing them, almost always can end in success. Caveat. The data strongly suggests 3 to 6 cycles. And I myself don't have the kind of stamina and endurance. I am very lucky in that I did my first egg retrieval and fertility preservation when I was 31, 12 and a half years ago. I didn't do an embryo transfer until 5 years later. And then I'm not doing another embryo transfer until 7 years later. So there's been a lot of space for me and women who it's clinically warranted for them to do back-to-back IVF. I have massive amount of respect for you and admiration because it's so hard and we get how hard it is. But the data does really show, keep at it, don't give up. If you can afford to do a couple retrievals and do, and maybe genetically test the embryos. We have another partner you can learn about called Avrio Genetics that does non-invasive genetic testing of embryos. They test the solution around the embryo so you get a little bit more accurate data on what's normal and not normal, which is just an amazing intervention or innovation in and of itself. We have a YouTube video on that. Lauren, I would love for you to hop on the app and ask some more questions and get in touch with our navigation team because we can help you directly with some of these questions as well, and we'd be happy to. Everybody can email navigators@medanswers.com. Lauren did do genetic testing on the embryos or on the tissue from the miscarriage. I myself had 5 miscarriages, so that I understand how painful that was. Yeah. Let's see. And then Danny Mack has a question. If man has no sperm count, but sperm was found when you had surgery, can IUI be performed or do you still have to go under IVF? I would say, Danny, unfortunately, IVF is going to be the best option in that case, because if it's very few sperm that had to be retrieved surgically, it's probably not enough sperm to do IUI, and they're going to want to do ICSI, which means they pick the best sperm and inject it directly. Your case is kind of a perfect indicator for that, because if they have to go in and do a testy procedure, then normally there's just not enough sperm to warrant even trying an IUI. And I wouldn't want you to waste a cycle. I wouldn't want you to waste money, even though we've cost compared this too, that because the success rate of IUI is lower than IVF, when you do a cost comparison, the number of IUIs you need can sometimes, a lot of times, be more expensive than just doing IVF itself. But if everything checks out with you and it's really a male factor issue, then you could head into it, with expecting, very good success. Especially if the sperm looks really good, under a microscope. Lauren, I'm so sorry about that. So you did genetically test the embryos, and that still happens. It doesn't take the risk of miscarriage down to zero, and it's so confusing and it's so frustrating. We've talked on this, on our channel and on our show with Dr. Serena Chen about when is uterine receptivity testing helpful. It's not warranted until you've had 2 failed transfers. But if you do have miscarriage history, then there's some extra genetic testing of you that can be performed to rule out all kinds of things. And we do so many of these episodes now. I'm forgetting which episode it was, but it was with Dr. Serena Chen. So check in our chat under or under our IGTV under Monday Motivation. We also have a ton of content on our YouTube channel, and Dr. Chen and I did talk about some other causes of miscarriage recently, and the benefit of doing karyotype screening and looking at some other genetic markers for you, that might help you optimize your own cycle and optimize your own lifestyle to help prevent that. And it's not your fault. So I'm saying that all with a caveat, Lauren, it's not your fault. And there's other things going on. We can only test. There's so much we can test, and then there's so much we still can't test with embryos. So the genetic testing you did, and I did too with mine, that's as good as we have, but there's epigenetics. And as that embryo continues to grow, we're not doing continued genetic testing. It's very limited, even though it is helpful. It's also still really limited. We don't know everything that there is to know about those precious cells when you do the testing. And that's kind of as frustrating as the term unexplained infertility, quite frankly. We wish that we could get, and doctors do too. They get so frustrated all the time. REIs get super frustrated about not having all the data. They want more data, right? And that's what we love OOVA, is that you get more data. So this is another great question from Modern Mitten Mama. I love that handle. That is adorable. How many months do you suggest using OOVA? Is this something you should just do monthly or just long enough to get the data? I love that question.
Honestly, like I mentioned earlier, we're really accurate from cycle 1, just to understand how your data is fluctuating or your hormones are fluctuating by comparing to your baseline. But we do get smarter with every additional piece of data that we get. So on average, we're seeing that women are using this between 2 to 3 cycles, but we're getting pretty good success rates too. So I think the data is really speaking for itself.
I want to do it 2 months in a row because I have 2 different cycles. So I have an ovary where I have a 28-day cycle, and I have another one that I have a 31-day cycle.
Oh, that's so interesting.
So I want to do it so I can be a case study and we can evaluate my data. I've been that way my entire life too. It's so bizarre to me that is even possible.
I think it's even more awesome that you actually know that. Because so many women don't, and they're just why does my cycle fluctuate so much? And it is true. Our ovaries, yes, they're both in the body, but they're different.
We're not symmetrical.
Yes,
right. I don't
look robots.
This profile, they're not. It's not. I am very asymmetrical, right?
Right.
Your boobs are asymmetrical. You're stronger on one side than the other. I mean, everything about us is asymmetrical, including our ovaries. Yes. So. Yeah, perfect. Well, we've got to wrap up. We are so grateful for everybody that tuned in. This is an important conversation. Now, Amy is available to answer questions on the Fertility Answers app as well. So if you have questions that are about ovulation or your cycle itself, pop in there, ask those questions. But you can also follow her at Uva Life on Instagram, DM her, go to the website, uva.life. I love the URL of that. It's beautiful. And as always, thanks everybody for tuning in, and we are here for you. So thanks, and we will see you next time. Thanks, Amy. I know your son needs you. All right, take good care, everybody.
Bye.